I've been really involved with the DePuy recall, and then most recently the Stryker recall. The recall of the Stryker in particular happened about a year ago in July of 2012, when the company voluntarily recalled two of their models, popular models. And in particular, the Stryker models, there's two models here, but the most common model is the Rejuvenate model. And the Rejuvenate model was originally promoted by the company as a very unique device because it allows the surgeon to size the device based on the anatomy of the patient. Most hip implant models are they're sized as a one-size-fits-all, if you will, model where there's, there are varying sizes, but the Stryker Rejuvenate has different size balls, stems, and joints, which allow the surgeon to modify the device based on the size and anatomy of the person. And so these devices have been in use now for several years. As people have begun to get these devices, there's been a real unifying level of complaints when it comes to a lot of the problems that patients are having. In particular, a lot of times people who have received a Stryker hip, they may have some pain after the initial surgery. They may have some problems, some squeaking problems. They may have some issues related to the dislocation of the device. And they also may have sort of an overall, just a general feeling of malaise and just a lack of energy. And what we're seeing in these particular cases is the metals used in the manufacture of these devices is actually, the wear of the hip itself is actually causing the metals to splinter off into little pieces. And in the words of the company, fretting. And these little pieces of metal are actually getting absorbed into the tissue surrounding the joint. And it's these metals, which are heavy metals such as cobalt, chromium, that we don't have naturally in our body, are getting absorbed into the system of the body and causing a lot of problems.